My name is Joshua Koshki, and I'm a restorative and aesthetic dentist at Santa Monica Dental Arts in Santa Monica, California. Veneers are a popular option because they let us make very precise, natural looking changes. They're a great option when someone wants to improve their smile without it looking overdone. Veneers also allow us to refine shape, color, and balance all at once. So when they're done well, they just look like a very nice, natural set of teeth. Porcelain veneers can correct a lot of common concerns like chips, gaps, uneven edges, and discoloration that doesn't respond to whitening. They're especially helpful when multiple small issues add up to a smile someone isn't happy with. Instead of fixing things one by one, veneers let us create a more cohesive result. It's very efficient and a predictable option. When it comes to porcelain veneers, I believe customization is the most important part of the process. We look at the patient's facial features, the way their lips move, their smile line. I even look at the patient's personality and lifestyle. The goal is for the veneers to feel natural, not distracting or trendy. I believe the best veneers don't necessarily stand out, they just fit subtly. The result that I'm looking for is the result that the patient wants, but at the same time, a result that doesn't look fake and just looks like it always belonged to the patient. When it comes to choosing which aesthetic option is best, it really comes down to the specific situation. Bonding is the most conservative option, and it's great for small changes. It's done using a tooth-colored material made of composite resin. We can sculpt it directly onto the tooth, but it stains over time and it is subject to wear over time. When we're looking at crowns, crowns are used when the tooth needs a lot more strength or coverage. Since they fully cover and protect the entire tooth, it's a lot more stable and it's much stronger. Veneers sit in the middle. They're a very conservative option that bond only to the front of the tooth. So it's very similar to wallpaper in your home. They allow us to improve shape, color, and symmetry without removing much natural tooth structure. They also don't discolor over time and they help create a really balanced, harmonious smile. Most patients are surprised by how natural everything looks when they see the final results. A lot of them say it feels like the smile they were always supposed to have. There's usually an immediate confidence boost, even with subtle changes. That's what makes it a really rewarding moment to be a part of. When it comes to a veneer consultation, it is very visual and conversational. I like to talk through goals, take photos, and review what options make sense for that specific patient. There's really no pressure. It's all about education and clarity. I really want patients to leave feeling excited and informed, even if they feel it's not the right option for them. The goal is to make it a very educational consultation so they know exactly what their options are and they know that the goals that they're looking for can be achieved.